I think we're about ready to get going for session number 2. We're so glad that you're here again today. Thanks for being here. Before we get started, I want to make a plug for next week's session while we're talking here, because next week we had 2 really good sessions. One of them is called The Other Talk. Let me tell you a little bit about that one, because I think you might want to attend if you haven't signed up for it. I think you might want to rethink that one. The Other Talk is basically how to have a conversation, a successful conversation with your children about your future, about your financial future. And we just did this with our kids a couple of months ago, and I promise you, I read a book called The Other Talk that Donnie gave me. It didn't convince me, and we have a notebook, and we did everything it said, and it was good. It was great. So if you haven't signed up for The Other Talk for next week's session 3, which would be at 4:45, I encourage you to sign up for that. And then the second one, Randy is back here, Randy Ham. He's doing ID theft and theft protection, which is changing all the time, right? Scams and stuff. That's going to be a great session too. That will be the second section next week, okay? So we're going to go into our second session today, session 2. When we gave you the literature, we mentioned Tommy Chilcutt being our presenter, but Tommy had surgery and he's unable to work, and so we had to go to Plan B. But Plan B is great. Ron Hahn. Plan B. I shouldn't have said Plan B. This is probably should have been Plan A, but we had Plan B. Ron Hahn is. I just talked to him a while ago. He lives in Weatherford. He goes to church in Fort Worth. And so he's been in Weatherford since 1999, 26 years. Rotary and Nines Club, the Chamber of Commerce. He's active in 2000. He began his insurance career with New York Life. And then he started his own agency as Ron Hahn Insurance and Financial Solutions. Where is that?
202 South Waco and Oak Street.
Okay, in Weatherford.
1967.
Yeah, okay, in Weatherford there. His main focus is Medicare with extensive experience in life insurance, health, annuities, and long-term care that was mentioned a few minutes ago. And then he has received awards in Medicare Sales Leader for Blue Cross Blue Shield. I think you have some literature on that, just to give you information only. But these are really important topics. This has a lot to do with what we talked about the first session, but protecting your wealth this time. So this is Ron Hahn. We're so glad to have you. Let's give him a welcome to First Baptist Church.
Is this working yet? Uh-oh. Okay. Oh, it went off.
Yeah, there we go.
Okay, I'll turn it down a little bit now.
All right. Well, I'll talk quieter than I normally do for a second. Well, I said, introduce me as be sure that, tell people not to run out the door, but I grew up as a Church of Christer and kind of still am Church of Christ, but I go to an instrumental Church of Christ now. That's fun. I love it. Huh? Yes. The Richland Hills Church of Christ, they dropped the Church of Christ's name, and they have the campus we go to is 3 services instrumental. It's fantastic. And I think Don would agree with this. Rick Atchley's our minister, and he was talking about money today. And he said if you take joy in the accumulation of money and watching it grow, then you may have a problem. But if you take joy in what you can do with the money, you accept God's blessings wholeheartedly, but then you take joy in what the good things you can do with the money, right? Right? All right. Okay. So let me ask y'all some questions. You already talked about Social Security, which is great. We do a lot with Social Security. We bang our heads against the wall on SSA.gov all the time, trying to get people enrolled in Medicare A and B, and then we also will help you with your Social Security income if you're our client. We can't do that for everyone, or we'd have a line out the door every single day. All right, but that's one of the things that we do, self-service. Sheila is back here. Sheila's a licensed agent with us. She is my right-hand gal, but my wife is my right-hand gal. She's the office manager of the place. That's Gina. And Sheila came on board a couple of months ago, and she's taken a real burden off of me because man, our business has grown so fast, I had to have help. And bottom line, and we are growing like crazy. So I'm glad Sheila is here. Anyway, let me ask y'all a question. Who of y'all are getting close to 65? You are. You better come to me. You haven't been to our new office yet, though, have you? Oh, you did? Okay, cool. All right. So, how many of you are past age 65? All right, and already probably taking Social Security income. That's good. Do we have anybody that is TRICARE, retired military? All right. You do not need anything that someone like me has. TRICARE is all you need in addition to Medicare A and B. Anybody on state government Medicare? State, if you retire from the state, like even Weatherford College, you did. Tarrant County, yeah.
Ron, that's not teacher retirement.
Do what?
Is that teacher retirement?
TRS, if you're a teacher, you've got a choice between original Medicare and going to the supplement versus TRS care. And TRS care is an advantage plan, which we're going to talk about in a little bit. And so but ERS we don't mess with. If you work for Weatherford College or you work for the state of Texas, we can't do any better. Don't listen to any guy that calls himself an insurance agent, okay? You don't need us for that. In addition, TRS, though, you got to make a choice. You got to make a choice, and you'll understand a little bit better. But I'm going to start out with annuities. Donnie, I've known Donnie since my New York Life days. You moved here from Alabama. Roll Tide, right? Roll Tide. No, not Roll Tide? Okay.
Razorback.
Oh, you're Arkansas Razorback. Oh, boy. Okay. So, but, he said, okay, their topics are annuities, Medicare, life insurance, and long-term care. I went, do I have 6 hours? He said, no, you got 1 hour. I says, well, I can make an hour out of all those. And he said, don't. I went, okay. So I'm going to have to hit the highlights, folks. And there's not a PowerPoint approved, or I could get approved in time to do a seminar like that, okay? So we're going to do the old marker board and the questionnaire there. All right, so first thing I want to talk about annuities. First of all right, if an insurance guy like me, I had my securities license when I was in New York Life. I hated the investment side of it. I'll leave that to Don. I did not enjoy that, but I paid 23 death claims in 16 years when I was in New York Life. I love the protection side. So that's where when I went independent, I got tired of building New York's life business. I went independent, and that's where I went. But let me tell you something. If there's an insurance guy that says, let me manage your money for you, run the other way. You got it? Run the other way. If what I do some fixed annuities and some fixed indexed annuities. We're going to talk about those a little bit. But this is the most important thing you need to know. I do not have fiduciary responsibility. Don has fiduciary responsibility. So there are a couple of financial planners, and I have people come to me all the time. And they say, hey, can you help me out with my retirement? I say, sure we can. But I'm going to bring in someone that has fiduciary responsibility. And insurance agents are allowed, most companies allow them to put in 70% of your net worth, as long as 30% is liquid. They're allowed to put 70% of that into an annuity that has a long-term tie-up of your money. You can't touch that money for a long time, right? I will not, the top number for me is 50%. Don, y'all probably have 30% LPL. Yeah, the commissions on annuities are very high, okay? So follow the money, folks. Follow the money. And so don't, I bring in a financial planner. We sit down with the client. We talk about we do the fact find. We do the needs analysis. We do everything right then and there. I let the fiduciary take the lead because annuities have their place for some people. And are you one of those people? Well, that's what we need to find out. And so but an annuities, anytime you hear the word annuity, you think of the word guarantee. That's what an annuity is. And I need one of my sheets. Pardon me here. But and annuities with guarantees are not free. There are internal costs within those annuities because of the guarantees. It could be a life insurance benefit, a death benefit in that annuity. It could be with an indexed annuity that you never lose money. And we'll talk about how those work. It could be the guarantee income producing on that annuity. And that is a real strength of annuities, is the income stream that you cannot outlive. But it's ridiculously stupid to put more than 50% of your net worth into an annuity. And that's where we've seen so many abuses in the past, because people need their money and they can't get to it. We don't want that to happen to you. Make sense? And so there are two stages of annuities. You've got a deferred annuity, a deferred stage where it is also called the accumulation stage. The tax benefit of annuities is it grows tax-free. All right? With an annuity, your tax implications, you need to understand that. Because even if you put non-qualified money, that's just savings money. That's the same money you go buy a carton of milk with, right? This is not IRA money, or also called qualified money. If it's non-qualified savings, then you put an annuity and it accumulates for 10 years, and then you take that amount out. What is taxable is the gain. You can't it's not like life insurance where you can take the principal out first and not pay taxes. It is last in, first out. You need to remember that when it comes to annuities. Most people, when annuities, if it's a non-qualified annuity, they're doing it for one or two reasons. It's legacy money. They can't, or they want to pass on to the heirs, so they'll keep doing 1035 exchanges until they pass away, and let that money accumulate as a benefit for their heirs. But the cost basis falls along with it, doesn't it, Don? So if you put in $50,000 and 30 years later it's $150,000, then whoever gets that money has to pay tax on $100,000. Can you spread that out between 5 or 10 years now? Yes.
Spread it out on the annuity is 5 years. If it's an IRA account, then you've got a 10-year.
Okay. If it's IRA money, see, IRA is nothing but a tax law. A tax law that is attached to a figure. And we're going to talk about the annuities and how they accumulate. But
It can be spread over a lifetime. There are certain carriers that will let you do a post-death 1035 exchange where you can do it over a life expectancy as well.
really,
Yeah. You can't do that on a life
on a non-qualified. But on a qualified annuity, they no longer have the inherited IRA.
on a qualified.
Yeah,
It's got to come out within a 10-year period.
that's correct. So you can spread the tax burden out more if it's an IRA. I'm glad you're here, Don.
Non-qualified, you can do it over a lifetime.
Exactly. All right. The other stage is the annuitization stage, and that is the real benefit of an annuity. And that is the lifetime benefit that you can get from it. And also, a lot of these annuities will have, on the annuitization stage, if you enact the annuitization on it, that means you cannot outlive that money. Then they have a long-term care or chronic care rider on it, to which that distribution doubles for 5 years. So a lot of people can't get long-term care. They can't qualify for the life insurance or the chronic care rider, and so they're leveraging their money a little bit for that. We'll talk about long-term care as well in a minute. But what types of annuities are there? All right. A couple of years ago, I was at our big sales conference, and I spent 16 years in New York Life, and I'd done a ton of fixed annuities, right? Well, my marketer came up to me and says, you got to check out these MIGAs. I went, what in the world's a MIGA? It's a multi-year guaranteed annuity. Well, that's a fixed annuity. So if you see MIGA, it's an old fixed annuity. And that just means that they're going to declare the interest rate, and they're going to guarantee that interest rate for 2, 3, 5 years. The big advantage of the annuities is typically you can earn a little bit more than you can in the bank. And, when you've got money in the bank into a money market or savings account, what do you get every year on the money that you make on that? Huh? You get very little. But you also get a 1099. But you got to pay tax on it. Well, the tax is deferred on on the gain of the money. All right, so you don't pay tax. So where what would go to pay tax, now you get to earn the interest on that. The downside of that is your money's tied up for 2, 3, or 5 years because annuities have guarantees, and guarantees aren't free. All right. Another one is your immediate income annuities, the SPIAs. I haven't written a SPIA in a long time. Advantage is you give up $100,000 or whatever it is, you put that into this, and you trade that value of money for an income stream that lasts you your entire life. Or if you do it joint, as long as you or your wife are alive. The problem with that is, the downside is you give up the rights to the principal. You say, hey, come to me and say, yeah, we put $100,000 in a SPIA, and you want $25,000 of that later? Sorry. You contractually gave that money to the insurance company in exchange for income payments for the rest of your life. All right? That's why we move towards more to the fixed indexed annuities. Now, there's some fixed variable annuities that I can't talk about. Don can talk about that some other time, but I can't talk about those. But your fixed indexed annuities, they typically are designed to earn you 6 to 8% a year. Your money is not in the stock market, although your interest that is declared is based on the performance of an index, like the S&P 500. All right? But the concept with these fixed indexed annuities is you give up potential on the upside for downside protection. Well, real simple here, and if you're looking at these, here's some things that you need to learn. We don't have time to get into these today. But you need to understand how they figure these interest rates. You need to understand what a point-to-point is, 1 year point-to-point or 2 year point-to-point. Real simple, if it's a 1 year point-to-point, your money, your $100,000 is going to be $100,000 on day 364. On 365, they're going to go back and look at the performance of the index. And then they're going to look at the equation in which that interest rate is the equation that they use to figure the interest rate. And then they're going to declare that interest rate on day 365, and then they're going to credit your account with all that money. Make sense? If it's a 2 year point-to-point, then you're letting the insurance company keep the $100,000 out of the $100,000, and they look at the performance of that index over a 2 year period. You also need to understand what a cap rate is. If the cap rate on an index strategy is 10%, but the S&P 500 did 20, what do you get? 10%. You need to understand participation rate. So if you've got a participation rate of 60%, S&P did 20,000 and there's a cap of 10,000 on it. That means only 60%, $60,000 of your $100,000 is going to participate in the interest earned. All right? So you're giving up some potential on the upside. The great thing is when the market goes way, way down, say S&P does negative 20% after 2 years of having you've gotten 10% for 2 years, then it goes down 20%. Well, your value stays where it is. Now, you may have some costs that come out of that amount, some internal costs, because remember, guarantees aren't free, right? So one, we don't have time to get in the weeds here about indexed equity annuities. The other thing you need to understand is a margin or spread. These index, they have all kinds of ways. It's amazing what kind of ways they have to come up with an interest strategy on the index strategy. But that's what it is. And the other one is a variable annuity. And this is something I can't talk about. I can define it, but I can't talk about it because I gave up my license for that gladly in 2016. All right? Basically, your money in a variable annuity is in what's called separate accounts that are invested in the market. It could be, I like to call them a mutual fund of mutual funds. Is that a decent way to put it? It is. Again, it has guarantees. But I can't talk about those. So one, I wish we had, if you want to have me back, to have Don and I back together, we can come up with something on annuities, and we can get into weeds about annuities if you want. We really need to get into, because I've already answered the question here, when are annuities a good idea? All right, first of all, can I get your opinion here? If you got a net worth of $500,000 or more, you need to see a financial planner. Bottom line. Some financial planners say 250. If you want a financial planner at 250, you go do it. All right? That's the way it is. And is it a good idea? Well, what we look at here is, do you have enough money to retire on? What is your return going to be? If we mix an annuity into your portfolio, then it lowers the risk of your entire portfolio, basically, because we've got guarantees in there. But is there an income gap that you need to live by with your retirement and your Social Security and everything else? Then we look at the assets to see how are we going to fill that income gap. It may be with investment accounts. It might be an idea with an annuity. So guess what? You're going to have to schedule a meeting. Bottom line. Everybody is different. There's no one answer for everybody. Make sense? All right, so most of our business is on Medicare. And let me tell you something, folks. A lot of changes with Medicare. I don't like to get political. Do I have your permission to get a little political? Okay. Be careful. Well, all right. The Inflation Reduction Act caused inflation with Medicare. Okay, it just did. Did it help some people? You betcha. But it also caused inflation with Medicare. That's as soft as I can make it. How's that? Let's talk about enrollment periods, because everybody's coming up. Everybody enjoying the mail that they're getting in the mailbox, and the calls they're getting, or the emails. It's just crazy. All that does is foster confusion. And so, folks, when you turn 65, you have two decisions to make. It is really and truly that simple. And the first decision you have to make is, when am I going to go on Medicare? Are you still working? And you're on group insurance? Maybe you have a young wife and you need to work another 15 years because she needs insurance and you're going to be 80 before you retire? There's people out there doing that, all right? And so you're looking at, you do not have to worry about the late enrollment penalty for Part B as long as you have group insurance. So if you're on group insurance, about the only thing you need to do is Medicare Part A, and it's free. All right? The second decision you have to make is the most crucial decision you've got to make when it comes to Medicare, is which path are you going to take to receive your Medicare benefits? And that option is real simple. Either you do original Medicare, A and B is original Medicare, and you add a prescription drug plan, and you add a Medigap plan, also called a Medicare supplement plan. And there's three options there: a G, a Plan N, or a Plan G high deductible. I'm going to tell you where the industry is headed here. In the very short few months, there's some cool, really good things that are happening to combat the bad things that are happening. And so those are the only two decisions you have to make. After that, everything's logical. But if you're turning 65, you're in your initial enrollment period. And your initial enrollment period is 3 months before you turn 65 and 3 months after. Again, if you're working and you're on group insurance, all you need is Part A. Real simple to do. You got to get online with socialsecurity.gov, create an account, go log in to .gov or ID.me, go through the ID verification, and the application is very simple. If you need our help, let us know. All right. Then you have, when you turn 65, you've got a 7-month period. You've got 7 months to enroll in Medicare A and B. Or B, if you're not on group insurance. That is your initial enrollment period. But if you're working, then you're entitled to a special enrollment period. And you have the same 7-month period to get enrolled in Medicare Part B. Actually, you have 8 months after your group insurance ends, in actuality, when you get Medicare Part B. But don't do that because you're liable to have a whole lot of expensive hospital bills. But it just takes a little extra paperwork. No big deal. We've done hundreds of them for people. The other deal is I need an eraser. Here's something I want to spend a little time on, and that is the annual enrollment period, because the annual enrollment period has some very, very crucial things on it. And that enrollment period is October. It's the AEP, and it's October 15th through December 7th. My arms aren't that long. December 7th. And that is our crazy time. It's coming up and we're getting ready for it. All right? But during that time period, we can look at and review your prescription drug plans, that is Medicare Part D, or your Medicare Advantage plans. Okay? That's all we can do during that time period. If you are on group insurance, don't worry about it. It doesn't apply to you yet. But that is all we can do. Now, those two options which receive your Medicare benefits for you, this is where it comes into play. First option is to keep original Medicare, that's Medicare A and B, as primary. And you add a prescription drug plan. And then you add a Medicare supplement plan. And that's a G, a Plan N, or a Plan G high deductible. Those are your three options. Plan F is no longer available unless you were born or turned 65 before January 1st of 2020. It's gone. And they're actually looking at other Medicare letters to offer. Do what? Then you're on something that I can't sell anymore. All right. And that's perfectly fine.
Well, I just, I fell within that category where I was on Plan F, but I went to Plan G. I had to provide some information to them, Medicare.
Yep.
And I reduced my premiums by about $100
Exactly.
by going to Plan G.
We're moving a lot of people from Plan F to Plan G now. We're also moving a lot of people from Plan G to Plan N. Perfect segue into this next point. This, everyone needs to write down. This is the most important thing you can learn. Your Medicare supplement plans here have nothing to do with the annual enrollment period. The only time you have to get a Medicare supplement plan guaranteed issue, that means no medical questions, is your initial enrollment period or a special enrollment period leaving group insurance. It is from 6 months of your Part B effective date. That is your only guaranteed issue time. Remember that. All right. Medicare supplement plans, the only time that you don't have to answer the medical questions and prove to the insurance company that you're healthy enough to take the risk on is your initial enrollment period when you turn 65 or a special enrollment period with leaving group insurance. It is based 6 months from the Part B effective date. Okay? And this is the gold standard of coverage. Original Medicare with a supplement. I call it the King Ranch Ford of coverage. Okay? Because we're in horse and cattle town, right? All right? It is the very best insurance you can get, but it costs. It costs a monthly premium. But if you got a Plan G, what's your max out of pocket?
Annually?
Yeah.
I just got Plan G, so I don't know.
All right. The annual in your max out of pocket, your deductible is calendar year, not from your policy date. It's calendar year. This year, it's $257. How many of you would like to have a health insurance plan? It's not with a max out of pocket of $257. You'd take it, right? How about one that has no networks, nationwide, no networks? You can go see Dr. Pimple Popper if you want to, if she takes Medicare. All right? It don't matter. Where you are, you can go to Mayo Clinic, MD Anderson, you've got total control of where you go for your health care. There are no referrals to see a specialist required by the plan. And most importantly, this is worth writing down too. If you keep original Medicare, then the insurance company does not have the approval or denial rights for what the doctor wants to do. There are no prior authorizations to procedures. That is awesome. But it costs a premium. Right now, Plan G, your max out of pocket is $257. A Plan N, it's a little bit lower premium. An average premium when somebody's turning 65 for a Plan G is about $150 a month. Average premium for someone turning with a Plan N is going to be, with Plan N is about $120, $125. You have a $20 deductible when you go to the doctor and a $50 copay when you go to the emergency room. Big deal. All right? Plan N is very good. About to get into some things with the industry here. Second two, it's very important. One other thing, difference between a Plan N and a Plan G, it doesn't happen very often, so I wouldn't let it be a deterrent from going on a Plan N. A Plan G covers Part B excess charges at 100%. A Plan N does not cover Part B excess charges. Now, who knows what a Part B excess charge is? Anybody? Okay, when a doctor or facility does not take Medicare assignment, that means they have signed the document that says, yeah, we'll accept Medicare patients, but they have not signed the document that says we're only going to accept the fees that Medicare pays. Right? Then they are allowed to balance bill you up to 15% of the Medicare approved amount. We do not see these balance bills with doctors or specialists typically, or hospitals. We see it with the outliers, like the imaging companies, lab companies, the physical therapy companies, right? That's where we see these balance bills. And here's how it works. Do anybody here know what Medicare approved amount is for an MRI? $186. Gateway charges about $1,000. And Gateway is always trying to balance bill you. All right? But you can hold their feet to the fire. Because if you got a plan G, you can say, oh, no, I got a plan G. You're not allowed to balance bill me. I love making these calls. If you keep on trying to collect on this bill, I'll just turn you into Medicare for Medicare fraud. It goes away real quick. With a plan N, they're only allowed to balance bill you 15% of the Medicare approved amount. That is 15% of $886. Big deal. But here's what's going on in the industry. Insurance companies have had to take on a tremendous amount of cost, even with the new law that just passed by the state of Texas. We have seen, how many of you seen your supplement premiums increase big time in the last 2 years? You have, haven't you? That's because inflation and the burden of overutilization for Part B. People are getting